Client A, African American female, age 35. Good morning, ma'am. You have been in the hospital for symptoms of high blood pressure for the past few days. When you entered the hospital, you presented as alert and verbal times 4 with a severe headache lasting for more than 1 day. Blurred vision, shortness of breath, and pain to your upper right side belly, along with stating you had gained weight in the last 5 days with swelling to your lower extremities. With your history of chronic hypertension and no diabetes, which is a risk factor, it is always a good idea to be seen if you develop any abnormal symptoms. It was a good thing you recognized that something different was occurring and came to the hospital during your pregnancy of 20 weeks. And since this is your first pregnancy, you wanted to make sure you and the baby were okay. After running various tests to rule out gestational diabetes and any kidney disease, which include a urine sample and blood work, and platelet levels and liver enzymes, the results showed elevated proteins, and a non-stress test showed no fetal distress. The provider was able to determine you have a condition called pre-eclampsia, which is a serious increase in high blood pressure that can affect your kidneys, your heart, and the development of your baby. Prolonged pre-eclampsia can cause more serious symptoms, which include long-term kidney damage and damage to your heart, lungs, eyes, and or a stroke. One of the conditions it may also cause is preterm delivery for your baby. It can also cause placental abruption, but since you have no bleeding, heavy or otherwise, we monitor you as a safety precaution. Since you are only at 20 weeks of gestation, we educated you and your support system, which is your husband, on the fact that the baby is small and delivering the baby at this age can cause multiple complications, including a decrease in lung development for the baby. We opted for medication treatment with your permission. At that time, we asked for your understanding of your current care, and you stated understanding but reserved the right to ask questions if you had any concerns. We stated that yes, we would be more than happy to give any further explanations if needed or if your condition changed in any way. With your permission, you were started on IV hydralazine, which is an antihypertensive as a first line of defense, and you have responded well to it. The medication has helped decrease your admitting blood pressure from 200 over 102 to 132 over 76, and you report a decrease in headaches, blurred vision, and no more upper abdominal pain and no swelling to your legs. You are also started on IV magnesium, which is an anticonvulsant prophylactically, since most women develop seizures or can develop seizures with preeclampsia. You have responded well to all medications, and the fetal heart monitor shows no distress to the baby throughout your time here. On your discharge from the hospital, we will want you to continue your high blood pressure medications as prescribed. Follow up with all appointments to monitor your blood pressure. If you don't already have an exercise regimen, start one to help relieve symptoms of high blood pressure and monitor for any abdominal pain and bleeding with any that are signs for a developing baby may be in distress. Consider joining a support group if one's available, along with letting you current support persons know what to help you with and any signs and symptoms to look for if you develop any distress. If you develop any symptoms that you feel are unusual, we encourage you and your family to return to the ER for immediate evaluation. Do you have any questions or concerns? Thank you for your time.